Hi, I'm Roger Blumenthal, Professor of Medicine and Director of the Johns Hopkins Chickaroni Center for Prevention of Heart Disease. I'm very pleased on behalf of my colleague and co-chairman, Dr. Chris Cannon from Boston, to welcome you to the first session of CardioCareLive. I'm here with my good friend and colleague, Dr. Matthew Weir, who's Professor and Director of Nephrology at the University of Maryland School of Medicine.
It's a pleasure to be here and a pleasure to discuss a vexing problem that we all have to face periodically in our practice, and that is the issue of resistant hypertension.
Okay.
And really look at it.
And last question before you go on. You mentioned that thiazides don't work as well in people with low creatinine clearances. But if someone has a creatinine clearance of 30 or 40, is it still worthwhile to try adding chlorthalidone to a loop diuretic?
It's not well studied, but there is clearly a transition zone. And I'll be very honest with you, thiazide diuretics are not well studied in people with more marginal kidney function.
I see.
But I would submit to you that the longer, more powerful thiazides, which also have a more chaliuretic effect, are probably best used in that transition zone between when you would use a traditional thiazide diuretic and before you would start a loop diuretic.